Caffeine is a natural plant alkaloid, found in over 60 plants including coffee beans, tea leaves, and cola nuts. It is used to flavor food and drinks and even medicine. Caffeine is also a stimulant. The FDA states that caffeine is both a food and drug additive used to treat tiredness or drowsiness. It also increases your alertness and improves the efficiency of pain relief in medicine. In the US, over 80% of adults consume caffeine every day. On average, a person consumes 200 milligrams a day, which is equal to 2 5-ounce cups of coffee. A few of the most common sources of caffeine include coffee, tea, and energy drinks. The history of caffeine spans back thousands of years, but a common myth that is used to explain the origin of coffee is that of an Ethiopian goat herder who noticed his goats were usually hyper after eating a different kind of berry in a new pasture. In recent history, caffeine was extracted in its purest form, a white powder, in 1820 by a German scientist named Frederick Ferdinand Rouge. Today, caffeine is easily extracted through a variety of methods in order to create products including decaffeinated coffee and tea. Caffeine increases blood pressure by contracting the heart and blood vessels. It also rises plasma epinephrine and norepinephrine levels in non-habitual users. Heavy caffeine consumption raises the plasma levels of homocysteine, increasing the risk factor for heart disease. Caffeine is also known to be a powerful diuretic. Caffeine can mobilize calcium from cells and may lead to loss of bone mass. Particularly in doses of 300 milligrams, which is equal to 3 cups of coffee or more per day, it can result in both male and female infertility. Caffeine increases the release of acid in your stomach and sometimes leads to an upset stomach or heartburn. Consuming as little as 50 milligrams of caffeine per day increases a person's resting metabolism. The cerebral blood flow is proportional to the amount of caffeine consumed. As a result, there is an increase in efficiency with neurotransmissions involved in the cerebral cortex. This results in improvements with alertness, concentration, decision-making, problem-solving, and neuromuscular coordination. A 2009 study found that the risk of developing diabetes dropped by 7% for each daily cup of coffee. Previous studies reported that heavy coffee drinkers had a 50% lower risk of developing diabetes than light drinkers or non-drinkers. Scientists believe that coffee may be beneficial in keeping diabetes at bay in several ways, by helping the body use insulin and protecting insulin-producing cells, enabling effective regulation of blood sugar, preventing tissue damage, and by battling inflammation, a known risk factor for type 2 diabetes. New research from the Harvard School of Public Health suggests that drinking 4 or more cups of coffee daily decreased the risk of endometrial cancer in women by 25% as compared to women who drink less than 1 cup a day. Researchers have also found ties between regular coffee drinking and lower rates of liver, colon, breast, and rectal cancers. Polyphenols, antioxidant phytochemicals found in coffee, have demonstrated anti-carcinogenic properties in several studies and are thought to help reduce the inflammation that could be responsible for some tumors. Caffeine is not charted as other drug addictions. Usually, the most successful way to stop consuming caffeine is to slowly decrease your intake over time. This way, there is less withdrawal symptoms. Hypnosis, counseling, group talks, and therapy are all common techniques used for drug addiction, but usually with caffeine addiction, these measures don't need to be used. A few tips to stop consuming caffeine are to get more sleep, try to slowly switch to non-caffeinated beverages daily, and if feeling stressed out or needing an afternoon lift, try stretching. Approximately 68 million Americans consume 3 cups of coffee each day. Teens are increasing their consumption of caffeine rapidly, whether it be due to the social aspect or due to late-night studying and working. Every year the number increases and the age at which they begin drinking coffee becomes lower and lower. In 2013, 13% of gourmet coffee shop customers were teenagers. A recent concern has occurred that many of the teenagers buying coffee are teenage girls who are trying to replace meals with coffee in an attempt to lose weight. 1 cup of coffee contains 320 milligrams of caffeine. In order to get the same feeling of alertness or have the same effects, an individual would need to consume 9 12-ounce Cokes. It is estimated that energy drink sales will rise to approximately $27 trillion by the year 2017. 5% of adults consume 5 to 7 energy drinks a month, and 2% consume 10 every month.